So how does healthcare work? Here's all of us, here's all the stuff we want. We want doctors and hospitals and nurses and all that. And of course, between us is the money, right? And the money today is managed by payers. So there's, the federal government pays for the healthcare for the military, for the post office, for, all the things, Medicare, half of Medicaid. That's the state of Missouri. Now you all know that. So the states pay for things. That's one of the schools in Missouri, businesses. St. Louis business, I'm kind of, I guess, welcome to St. Louis. So these are all called payers, right? So our system today is what's called a multi-payer system, and this complexity is expensive. Complexity is always expensive, and the complexity corrodes quality, and the complexity leaves gaps that people fall through. So this is today's system. We're the only country that organizes healthcare finance in this way. And what I propose to you is we should get rid of all that. Oh, and so here's how this works. We each pay each of those companies a certain amount, so there's complexity there. Then they each have to have contracts with each of these things. It's a mess. This is how it works, and this is the really simplified version of how it works. So how could it work? You could get rid of all that and just have us pay into the federal government through our taxes, and we'll talk about specifically what that would mean. And so that's what a single payer means. That's the idea of a single payer, one payer. And my proposal to you is that the most sensible way to have one payer in the United States, have it be Medicare, improved Medicare. So what does that mean? What is improved Medicare? There's a couple major things that need to be improved about Medicare. The first is, of course, what I started with, the copays and deductibles. So when you hear us saying improved Medicare for all, one of the most important things is to get rid of those copays, get rid of the deductibles. Not cost anything when you go to the doctor, not cost anything when you go to the pharmacy, not cost anything if you have to go to the hospital. Get rid of the copays, get rid of the deductibles. And if you do that, then there's no longer a market for a supplement or for an advantage plan. So first thing, there's a number of things, we'll only talk about two. The first thing is improve Medicare by getting rid of the copays and deductibles. The second thing is there's important things that Medicare doesn't cover that it should. Medicare doesn't cover dentistry. People really value dentistry, and dentistry impacts the rest of your health in ways that are beyond scope for today. So cover dentistry. Give eyeglasses to seniors. Give hearing aids to people with Medicare. There's about 15 of these things. Expand the benefits. So that's what we mean, among other things, by improving Medicare, and then expand it. Give it to everyone. Give it to Congress. Give it to the president. Put everybody in the same program. Let the legislators be in the same program, so if they screw it up, they've screwed it up for their family and themselves. Have them be in the same program. Give it to school teachers. Give it to kids. Because then, every few years we have these fights about, are we going to expand the health care for kids? 60% of kids are on this S-chip program. Are we going to expand? Stop having those fights. Put them in the same program. Give it to low-income people and high-income people. And then you don't have to figure out who somebody is. You don't have to worry that they're bouncing in and out of the right income level. We wouldn't have those fights because everybody would be in this program. That's not just to be nice. That's the only way to get from those scary big red 18% overhead bars down to the sweet little 2% overhead. That's the only way to do it. You got to get rid of them, have everybody in them, gets us there. That's the best, not the only way, but that's the best way to get the country able to actually negotiate the prices of drugs down to where the world prices are. We pay double for that. Our prices are double. So that's the best way to do that. And it creates a large risk pool, which if you're an employer, really matters quite a bit.